And it's basically just a large room that has enough room for plenty of staff members, for lots of equipment, and for a lot of things to happen all at one time. We have specific carts, as you're looking at now, for pediatric emergencies, for adult emergencies, for airway emergencies. We have ultrasound capabilities that we can bring right into the room here. Behind the cabinets on the opposite wall over here, we have a lot of other specific pieces of equipment that we don't need to leave out all the time.
So it's amazing. And not only the equipment, but the supplies alone, down to bandages and medications as well. I mean, do you have medication here? You must have some sedatives and painkillers here.
The vast majority of our medications are managed in a hospital-wide electronic medication dispensing system where we enter the patient's name and the order from the computer, because all of our orders are entered directly into the computer by the physician. The nurse is then pulling out the specific medication that agrees with the physician order, so there's much less of a chance of a medication error. And then they bring that medication directly to the patient's side. They will then scan the medication. All meds have a barcode on them. The patient's wristband has a barcode on it, and they scan the medication and the wrist to make sure that everything matches, so we're not having issues with medication inaccuracy.
And as you mentioned, you get every age person in here.
We do.
Adolescents, young children, as well as adults, right?
We do. Everybody right up to birth. I have not had to deliver a baby down here. And I'd like to keep it that way. But
this would be the room that you bring them into?
We would bring them in here.
Oh,
when expecting mothers do come in ready to deliver, we give them a real quick, hi, how are you doing, what's the situation kind of assessment. And if we feel that they're stable enough, we take them up to maternity and let the maternity experts take over from there.
And what do you think of that? I mean, you get to touch all the different departments in this hospital, this surgical wing. I mean, you really are very well set here in Fulton County.
You really can't talk about the emergency department without talking about the whole hospital. Because it's true, we do interact every day with maternity, with the surgical services, with the intensive care unit, with the lab, with diagnostic imaging. Every single department in the hospital interacts directly with us, and none of us would be anywhere if it wasn't for the housekeeping staff.
You're exactly right. I mean, what would you do without cleanliness and sanitary conditions?
Right.
We'd be creating more problems. Let's talk about our walk into the emergency room. Someone comes in, you've got a new entrance. You even have parking now for emergency. They don't have to park over in the parking lot and walk all the way over. You have convenient emergency parking. Looks like there's a lot of spaces out there. They come in now, come into the emergency room, and now there's someone right at the window that will greet you.
Right, and in the ideal situation, that person is not talking with another patient at that time. So they would bring you right in and start the process that we call triage. And what that is a few-minute interview with the patient to determine on a big picture what's going on. What problem are you here for today? How long has it been going on? And what are your other medical conditions that we need to take into consideration?
And as tough as it is, family members need to realize when you bring someone in the emergency room, you yourself need to be calm. That will help not only the patient, your loved one, but it helps the doctors and nurses really assess what's going on. You get 2 or 3 people all talking at the same time. It just makes it a confusing situation for you folks, right?
Right. Especially when family members or the patients themselves get upset and start saying, well, I just need to get in. I just need to get in. Get me in a room right now. I need to be admitted right now.